Welcome to H&HN Daily. I'm Susanna Hopzollern, Senior Editor for Hospitals and Health Networks magazine. Today's challenges in healthcare are not incremental, but transformational. To meet the challenges of lower payments for services and the rise in consumerism, most healthcare system leaders believe that they will need to improve clinical care and cost performance significantly by 20 to 40% over the next 3 to 5 years. Today, I'm joined by Rob Schreiner, Managing Director at Huron Consulting Group in Chicago, to discuss building the new care model. Welcome, Rob.
Thank you, Susanna.
How does the healthcare system change that physician culture from the fee-for-service to build really this culture of responsible stewardship?
First and foremost, you have to create a belief system among doctors that it is noble and patriotic to remove waste, that waste does exist in healthcare, that waste can be measured, and that it is a noble pursuit to eliminate that waste. So number one, create that belief system in your group of doctors. Number two, enable them to act upon that belief. So, for example, they have to have all the right clinical information in the moment of decision. They have to be trained, for example, of how to have value-based conversations and shared decision-making conversations with patients. And you have to involve doctors in the redesign efforts.
What is teaming and how does it work in healthcare?
Most people are very accustomed to thinking about teaming in the following way, that a group of individuals, each with different training or different skill set, is assembled for some common purpose. For example, score more points than the other team. But in complex human endeavors like healthcare or flying an airplane, other attributes in teaming are probably even more important. Number one, there has to be psychological safety on the team. That is to say, every individual, regardless of hierarchy or their past training, is equally empowered to point out a problem or suggest an improvement. Number two, there should be structured communication. So that could be huddles at the beginning of clinic or debrief sessions after clinic or a pre-surgical plan that's articulated in the operating room, whatever. But, a defined architecture to communicating clinical information among individuals on the team that leads to deeper and broader understanding. And then number three, everybody on the team has the same shared mental model of what we're here to do for that patient or that population of patients or that day.
Can you measure the results of teaming efforts in healthcare? Absolutely.
So there's a strong correlation between the so-called culture of safety among individuals on the team and the degree to which those individuals behave in a team-like fashion. And so there are safety attitude questionnaires that you can administer in, say, 20 minutes for each individual on the team. And the composite score of that safety attitude questionnaire for a given team has a very strong predictive value of whether that team will create highly reliable, safe care.
How can providers improve the customer experience to gain the loyalty and trust of consumers, the community, and employees?
I'll first say that we in the healthcare profession, we doctors, nurses, pharmacists, and so forth, believe that healthcare quality can be measured along biometric determinants. So was the right diagnosis made? Was the right treatment implemented in a timely way? Was it effective for that particular treatment? So that's how we in the industry think about quality. That is not at all how patients and lay people think about quality. For them, it's all about the care experience and service. They will make very firm judgments about the quality of healthcare that they're receiving based upon the care experience that they do or don't get. So, So there are a few very simple but very effective ways to convey to patients that we care about them and that we value them and that we are organizing our care in a way that is completely and utterly in their interest. Number one, make it easy to get care. So that can be a telephone system that works and a person actually answers and helps them get an appointment. It can be as simple as appointment availability, being able to see your primary care doctor within a day or two or a specialist within that week. It could be wayfinding once you're in the building. Patients they're anxious about what the doctor's going to say and not say. We don't need to add to their anxiety by making it hard to get through the system or get to the right place. So those are some examples about access to care. Number two, everybody on the team should find every opportunity to express empathy. That can be as simple as addressing a patient in the eye, greeting them by their name, us telling them our name, and some sort of a meaningful and sincere expression that we intend to earn their trust and that we're delighted that they've put their trust in us. And then I would say the last characteristic to create really powerful care experiences are to personalize the care. So most patients don't want to be given healthcare choices based upon 1,000 patients similar but not identical to them. They want some element of personalization and a feeling that their doctor really knows them, and the nurse and everybody else really knows them as an individual and has, with their help, selected a treatment plan that is just right or should be just right for them as an individual.
Thanks for joining us today.